The sound of rain was the only thing keeping the night alive. A thin drizzle slicked the asphalt, turning the streets into mirrors of light and regret. The city was winding down, restaurants closing, buses half empty, the hum of life slowing to a whisper. Then came the screech, rubber against wet pavement. A metallic cry followed by the sickening crunch of steel folding against steel. For a moment, there was silence again. Then, the sirens began. At STT, Victoria Medical Center, the emergency bay was already pulsing with life trauma patients, coughing children, the steady rhythm of code calls echoing through fluorescent corridors. Nurse Amara Johnson glanced at the digital clock above the nurses' station. 11:42 p.m. Another long shift. Her hair was tucked beneath a navy scrub cap, her eyes alert despite the fatigue softening the corners. She'd just finished charting a post-op note when her radio crackled to life. Incoming trauma. Male, 60s, Mava critical. 10 minutes out, Amara straightened instantly. ETA 10, she repeated to the unit. Level 1 trauma, Prepper 2, across the hall, Dr. Malik Carter was finishing sutures on a teenager with a deep laceration when he caught the announcement. His focus didn't waver, he was known for that, but his jaw flexed slightly. Another one, he muttered, cutting the final stitch with clinical precision. Finish dressing that wound, he told the resident beside him. I'll meet the trauma team downstairs. Malik stripped off his gloves, washed his hands, and pulled on a fresh pair as he walked. He didn't rush. He never rushed. But something in the tone of that dispatch, the voice of the paramedic, tight and shaky, told him this would be ugly. By the time the ambulance lights streaked across the glass doors, the trauma team was ready. Amara waited near the stretcher bay with Dr. Sophia Lynn, their attending, who had her arms crossed and her gaze sharp. Vitals are unstable, Sophia said, scanning the monitor. Let's keep it tight. The doors slammed open. Paramedics burst in, soaked from the rain, pushing a gurney wrapped in the cold blue light of the ambulance bay. Male, 67, unrestrained driver, one of them called out. T-bone collision, driver side, probable rib fractures, internal bleeding. BP dropping fast. Malik was already at the bedside. Name, the paramedic checked the ID from a torn wallet. Walter Briggs. Former law enforcement, according to this. Malik froze for half a second, just long enough for Amara to notice. But he recovered instantly, his tone clinical again. Get him on monitors. Let's move. Amara cut through the man's torn jacket and shirt. The stench of gasoline and blood filled the room. Multiple contusions. Possible femur fracture. Chest trauma. She moved with practiced precision, her voice calm, her hand steady. Pulse weak. He's crashing, doctor. Epi now, Malik ordered. Prep for intubation. The team worked in silence, broken only by the beeping of machines and the rhythmic commands of Malik's voice. Suction. Tube. Clamp. 4. Everything in motion, a storm of skill against the slow pull of death. Minutes stretched into eternity. Finally, the monitor beeped into a steady rhythm again. Got him, Amara whispered. Malik exhaled slowly, stepping back. Sweat glistened on his forehead under the surgical light. He looked at the man lying unconscious, pale, weathered, the face of someone who'd seen too much and cared too little. Dr. Lin's voice broke through the silence. Let's get him to or 2. Possible splenic rupture. Carter, you're leading. Malik nodded, expression unreadable. On it, Amara began disconnecting lines, moving efficiently around the bed. But she caught that flicker again, something behind Malik's eyes. Recognition. She'd seen it before in soldiers recognizing an old wound, in doctors facing ghosts they thought they'd buried. She didn't ask yet. Not here. Not in the middle of the storm. The elevator ride to the or was quiet, except for the hum of machines. Malik stared at the monitor screen, the numbers dancing between life and loss. Walter Briggs. The name echoed in his mind like a curse. He'd seen it years ago, stamped on paperwork, signed beneath a report that ended his internship at another hospital. It had been a different city, a different life. Malik had been accused of insubordination after challenging a racist slur from a senior security officer, a report filed by one Walter Briggs. The complaint stuck. His contract wasn't renewed. It took him 2 years and a court battle to rebuild his career. And now, here the man was, broken, vulnerable, lying on Malik's table. In the operating room, the atmosphere shifted. Sterile lights, stainless steel, soft murmurs of precision. Amara adjusted the fur line, glancing at Malik through the visor of her surgical mask. He didn't need to say anything. She could feel the storm in him. Dr. Lin's voice cut through the tension. "Ready, Dr. Carter?" He inhaled. "Ready, scalpel." Incision. The familiar rhythm returned. Malik's hands were steady, perfectly steady, but inside, everything was trembling. He could feel the weight of every cut, every pulse. "BP holding," Amara said softly. "Good. Keep him warm." An hour passed. The procedure was complex but clean. Malik's training carried him through muscle memory and instinct. By the end, the bleeding had stopped, the vitals stabilized. Dr. Lin stepped back. "Nice work, team. Let's close." After the surgery, Malik stripped off his gloves and scrub cap. He stared at the sink, letting the water run cold over his hands. Amara joined him quietly, leaning against the counter. "You knew him," she said softly. Malik didn't answer right away. He dried his hands, watching the reflection of his face in the mirror, calm on the outside, chaos beneath. "Yeah," he finally said. "A long time ago." Amara tilted her head. "He did something." He met her gaze in the mirror. "He tried to end my career, maybe even my faith in people." Amara didn't flinch. "And you just saved his life." Malik gave a tired half smile. "That's the job, right?" She looked at him for a long moment. "No, Malik, that's character." He didn't reply. But when she left, he stood there a little longer, staring at the blood still swirling down the drain, wondering if redemption could ever flow in the same direction. Later, in the dim corridor outside the ICU, Malik walked past the observation window. Inside, Walter Briggs lay unconscious, pale against the sheets, machines keeping time. For the first time, Malik noticed the tattoo on the man's arm, a faded American flag with the words "Serve and Protect." Malik let out a hollow laugh under his breath. "Guess we both did that tonight." He turned away, exhaustion settling deep in his bones. Behind him, the monitor beeped, steady, alive. Life didn't care who deserved saving. It just wanted to keep beating. And tonight, under the same skin, that was enough. Morning came slowly to steady. Victoria. The rain had stopped, but the sky still hung heavy, painted in the soft gray of unfinished storms. Inside the ICU, monitors blinked their quiet rhythms, and the air carried that sterile mix of hope and exhaustion. Walter Briggs lay motionless, pale under the thin hospital blanket. His chest rose and fell mechanically, each breath a reminder that life sometimes refuses to let go even when the soul beneath it doesn't want saving. Dr. Malik Carter stood by the glass partition, silent. He wasn't watching the machines. He was watching himself reflected faintly in the glass beside the man who once ended his career. The irony was poetic, almost cruel. He'd spent years mastering the art of emotional detachment, of stitching wounds without letting the memories bleed through. But some ghosts don't respect sterile gloves. Amara's voice broke the stillness. "You've been standing there for 20 minutes, she said softly. Her tone wasn't judgment, it was concern wrapped in calm. Malik turned slightly. "Chart says he's stable. Good vitals, normal sinus rhythm. Physically, yes," she replied. "Emotionally, we'll see." Malik exhaled, rubbing the back of his neck. "You think he even remembers me?" Amara raised a brow. "Would that make it better or worse?" He didn't answer. By mid-morning, Walter began to stir. His eyelids twitched. The faintest groan slipped from his throat. Amara moved first, professional and composed. "Mr. Briggs, can you hear me?" she asked, her voice a practiced blend of firmness and reassurance. The old man's hand twitched. His breathing quickened. Slowly, his eyes opened pale blue, bloodshot, confused. He blinked, adjusting to the light. Where am I?" "You're at STT. Victoria Medical Center," Amara said. "You were in a car accident." "You're safe now." Walter frowned, scanning the room, the machines, the IVs, then her face. Something in his expression shifted. Confusion gave way to something darker. You, his voice cracked, weak but sharp. You're one of them. Amara paused, knowing what was coming. One of who, sir? He swallowed hard, his jaw tightening. You people. You, she didn't let him finish. You were in critical condition, Mr. Briggs. We had to operate immediately. Dr. Carter saved your life. He turned his head slowly toward the doorway where Malik now stood. For a long, quiet moment, their eyes met. Recognition flickered in Walter's gaze, faint at first, then undeniable. You, he rasped. I know you. Malik's posture didn't move an inch. Yes, sir, you do. Walter's voice dropped to a hiss. You shouldn't be here. Amara felt the air shift. She took a small step closer to the bed. Mr. Briggs, please don't touch me, he snapped, voice hoarse but full of venom. Get your hands off me. The monitors spiked, heart rate jumping, blood pressure rising. Malik took one step forward, tone controlled but edged. Mr. Briggs, you're in a hospital. You need to calm down. I don't need help from. Walter stopped himself, the word choking in his throat. Amara's hands tightened around the chart. She'd heard every slur in the book, seen every version of this look, fear disguised as hatred, but seeing it aimed at Malik after what he'd done, burned in a different way. Dr. Sophia Lynn entered, drawn by the commotion. What's going on here? Walter pointed weakly at Malik and Amara. I don't want them near me. Not him, not her. Get me a real doctor. Silence hung heavy, thick enough to suffocate. Dr. Lynn's voice turned to ice. Dr. Carter is your attending. Nurse Johnson is your assigned nurse. If you have a medical concern, you can voice it respectfully. Otherwise, I suggest you focus on healing. Walter glared, lips curling. You people protect your own. Dr. Lynn didn't blink. We protect our patients. Even the ungrateful ones. Malik's jaw clenched, but he stayed silent. His heartbeat thundered in his ears, louder than the monitors, louder than the rain that had begun again outside. Amara finally spoke. Mr. Briggs, if you'd rather not see me, I'll have another nurse check in for vitals. But understand this, no one here wants anything but to keep you alive. Walter's gaze lingered on her, filled with the kind of disgust that rotted from the inside out. Alive, yeah. Maybe I'd rather be dead than owe my life to people like you. The words landed like a slap. Amara didn't flinch. She'd been hit harder before, not with fists, but with that same centuries-old contempt. She turned toward Malik, her voice barely above a whisper. I'll handle vitals later. She walked out, slow and steady, leaving the room cold behind her. Dr. Lynn placed a hand on Malik's shoulder as the door shut. Do not engage, she said quietly. You know that. I didn't, Malik replied, though his voice trembled slightly. Not yet, Dr. Lynn sighed. Good, keep it that way. When she left, Malik stayed watching Walter as he lay back against the pillow, breathing hard. He could see it, the hatred, the fear, the ignorance. It wasn't new. It was just louder here, in a place built on the irony of saving everyone. Hours passed. By evening, the ICU had quieted again. Malik sat in the staff lounge, hands clasped, staring at the untouched cup of coffee cooling beside him. Amara entered, dropping into the chair opposite him. Neither spoke for a while. Finally, she broke the silence. You handled it better than most would. He gave a short, humorless laugh. You mean I didn't throw the bed through the wall? Something like that. He rubbed his temples. He looked right at me like I wasn't even human. Amara leaned back. Some people mistake hate for power. But it's just weakness wearing armor. Malik looked up, eyes tired. You ever get used to it? She hesitated, then shook her head. No, you just get better at surviving it. They sat there for a long moment, listening to the low hum of vending machines and distant overhead pages. Then Malik whispered, I don't know if I can treat him. Not like this. Not knowing who he is, what he did. Amara met his gaze. You already did treat him. You saved him. The rest. That's between him and whatever God he prays to. He nodded slowly, though the storm didn't quiet inside him. That night, Malik couldn't sleep. He walked the corridor outside Walter's room, stopping just outside the glass. Inside, the old man was asleep again, oxygen mask in place, machines beeping steadily. For the first time, Malik saw something that wasn't hatred, just age, fragility, mortality. A man stripped of the uniform, the badge, the false power, just skin, blood, and fear. Malik whispered under his breath, "You tried to break me once." He paused. "But maybe that's not who you are anymore. Maybe it's who you were." He wasn't sure if he believed it. He wasn't sure if he could. But he turned away anyway, leaving the light from the ICU reflecting faintly across the corridor floor like the faintest echo of something human trying to return. As he reached the nurse's station, Amara was there again, filling out notes. She looked up, her voice soft. "Can't sleep?" "Not tonight," Malik said. She gave a small smile. "Then at least you're not alone." For the first time that day, Malik allowed himself a quiet laugh. "Guess misery likes company." "Not misery," she said, closing the chart. "Purpose." He looked at her, unsure if he could feel that yet. But when he walked away, her words followed him, quiet, steady, and truer than anything he'd heard all night. Behind the glass, Walter stirred again in his sleep. This time, his breathing hitched a faint tremor, a flicker of memory cutting through the haze of anesthesia and bitterness. Somewhere, deep in the space between guilt and mortality, something in him cracked. A sound escaped his throat, not a curse, not a word, a sob, and in the hall outside, Malik paused as if he'd heard it. He turned his head slightly, his eyes softening for just a second. Then he kept walking. Because mercy, like medicine, isn't a cure. It's a choice. The next morning, sunlight spilled across the ICU in pale, colorless stripes, not warmth, but sterile brightness. Hospitals never really woke up. They simply shifted from night's exhaustion to day's exhaustion. Dr. Malik Carter arrived earlier than usual. He'd barely slept. His thoughts were restless, looping through flashes of memory and the sound of Walter Briggs' voice dripping venom the night before. He walked past the nurse's station, where Amara Johnson was reviewing charts with a fresh coffee in hand. "You're here early," she said. Malik forced a smile. "Couldn't sleep. Figured I'd start the punishment early," she smirked. "You know, normal people take up running or meditation. I operate on people who nearly die. That's my version of yoga. Yours is louder," she replied. The easy banter was a thin layer over something heavier. They both knew it. The kind of heaviness that couldn't be charted in vitals or lab results. Walter Briggs was awake when Malik entered his room. He was sitting upright, oxygen cannula in his nose, staring out the window as if the skyline itself had personally betrayed him. When he turned his head, his face tightened instantly. "Didn't they have anyone else to assign?" Malik stood at the foot of the bed, clipboard in hand. His tone was controlled, clinical, but his eyes didn't flinch. "You're my patient, Mr. Briggs. I don't get to choose that." "Neither do you." Walter's mouth twitched into a bitter smile. "You always talk that way, doctor. So full of yourself." Malik didn't rise to it. "How's the pain?" "Manageable." "The real pain is having to look at." "Stop," Malik said, his voice suddenly sharp. "You're in my care, Mr. Briggs. That means we both have responsibilities. Mine is to keep you alive. Yours is to let me." The silence that followed was knife-edge thin. Walter looked away, grumbling. "You people think you know everything." Malik wrote something on the chart, his tone cold. "Not everything. Just enough to save your life twice in 24 hours. That landed." Walter's eyes darted up, something flickering there. Not remorse, but surprise. He hadn't expected defiance. Amara entered with her usual composure, carrying a tray. "Breakfast time, Mr. Briggs," she said, her voice firm but gentle. "Oatmeal, fruit and coffee." Walter's eyes narrowed. "Don't need charity." "It's not charity," Amara said evenly. "It's nutrition." He glared at her hands as she adjusted his fore. "You people always think you can just touch anyone, don't you?" Malik's jaw tightened. Amara didn't respond, not yet. She finished checking his vitals, steady as stone. When she turned, her expression softened, not pity, not anger, just clarity. "Mr. Briggs," she said, "if you're looking for an enemy, you won't find one here. You already beat yourself at that game." He stared at her, stunned into silence for the first time. She left the room without another word. Later, in the staff lounge, Amara leaned against the counter, eyes closed, breathing out the anger she hadn't let show. Malik entered quietly, holding two coffees. He placed one in front of her. She opened her eyes. "Don't tell me you're going back in there. I have to," he said. "Rounds, rounds," she repeated, shaking her head. "You're not a machine, Malik." He sat beside her. "You think I don't know that? Every time I look at him, I feel it. That anger, that memory." Amara looked at him. "Then why stay calm?" Malik's voice lowered. "Because the moment I stop, he wins again. And I've already given enough years to men like him." Amara nodded, quiet pride softening her features. "You're stronger than you think," he smiled faintly. "Or just better at pretending." That afternoon, Walter's daughter arrived. Claire Briggs, early 30s, blonde, dressed in a corporate suit that looked too expensive for the hospital room she walked into. Her expression was pure disapproval, but not for Malik or Amara, for the situation itself. "Dad," she said sharply, "what did you do this time?" Walter scowled. "Got hit by a drunk driver." "That's what?" Claire crossed her arms. "And you're making friends with the staff already, I assume?" "Funny," he muttered. "Real funny." Malik stepped forward. "I'm Dr. Carter, your father's surgeon. He's stable now, but he'll need rehab and follow-up care." Claire turned toward him, polite, professional, but uneasy. "Thank you, doctor. I appreciate what you did," Walter muttered. "Don't thank him." Claire ignored it. "Is he lucid?" Malik gave a measured nod. "Mostly, but agitation could slow recovery. He should focus on rest." Walter snorted. "You mean keep my mouth shut?" Malik's tone didn't waver. "That would help." Outside the room, Claire stopped Malik in the hall. "Listen, Dr. Carter," she began hesitantly. "My father, he's complicated." Malik raised an eyebrow. "That's one word for it." She looked embarrassed. "I know what you're thinking. I've heard stories, things he's said, done. I can't defend any of it. But he's still my dad." Malik nodded, his voice even. "And he's still my patient." Something softened in her expression, respect, maybe even shame. "You must think we're horrible people." Malik shook his head. "I think you're people. That's enough for me to do my job." She gave a weak smile. "You're kinder than he deserves." Malik didn't respond. He didn't need to. As the day faded, Walter grew restless. Amara checked on him every hour, keeping interactions minimal. He refused most of his meals. When Malik entered in the evening, Walter spoke without turning his head. "You people really think you're saints, huh?" Malik sighed. "No. Saints don't work 20-hour shifts and cry in parking lots." Walter's lips curled. "Clever. You talk like someone who's had it easy." Malik stepped closer, voice low. "Easy? You think I got here because it was easy?" He leaned forward slightly. "I had to work twice as hard for half the respect, and I still save men who would rather die than let me touch them." Walter looked up sharply, anger faltering into silence. Malik straightened. "You're alive, Mr. Briggs. That's the only thing that matters right now. You don't have to thank me. You just have to heal." He turned to leave, but Walter's voice stopped him. "Why did you save me?" Malik paused. The question hung in the air. He turned slightly. "Because that's what I do." Then he walked out. In the corridor, Malik found Amara waiting. She had been listening, not eavesdropping, just sensing. "You okay?" she asked. He hesitated, then nodded. "He asked why I saved him." "And what did you say?" "That is what I do." Amara studied him for a long moment. "And what do you think the real answer is?" He didn't respond. Not because he didn't know, but because the truth was too raw to name. That night, thunder rolled outside again, faint, distant. Walter couldn't sleep. The drugs dulled the pain, but not the thoughts. Images swirled behind his eyelids. Flashing lights, shouting voices, the memory of a young doctor in another hospital years ago, dark skin, steady voice, eyes burning with dignity. He remembered his own voice back then, cruel, dismissive, trying to put the kid in his place. He'd called security. He'd filed the report. He'd watched that young man's future crumble, and he'd never thought about it again. Until now. He shifted in the bed, guilt gnawing quietly through the cracks of arrogance. Outside his room, the sound of footsteps echoed. Malik on his rounds, quiet, efficient, unaware of the ghosts now haunting his patient. Walter turned toward the glass window, staring at Malik's silhouette through the curtain. For the first time, there was something in his eyes other than hate, recognition, fear, and maybe, just maybe, the smallest flicker of shame. In the staff lounge, Malik sat again, staring at his hands. Amara entered, her presence calm as always. "Long day," she said softly. "They're all long," he replied. She studied him for a moment. "You're not angry anymore." He looked up, surprised. "What makes you think that?" "Because anger talks loud," she said. "And you've gone quiet." He smiled faintly. "Maybe I'm tired of the noise," she nodded. "Silence can be healing. Or dangerous." He met her gaze. "Which one is this?" Amara's lips curved slightly. "Ask me tomorrow." As the night deepened, Malik walked one last time through the ICU corridor. He paused at Walter's window again. Inside, the old man was awake, staring at him through the glass. Neither moved, neither spoke. For a moment, it was just two men, one standing, one broken, divided by glass, by history, by skin. Then Walter looked away, eyes glistening faintly under the monitor's glow. Malik turned too, his reflection blending with Walter's in the glass. Two faces, one human outline. Different skin, same silence, same fragility. Hospitals are made of ghosts, not the kind that haunt the hallways, but the ones that live inside people who can't forget. And today, Dr. Malik Carter felt like he was walking through every one of them. The ICU lights were dimmed to morning mode, cold, flat fluorescence washing over tired faces. The night shift was handing over, nurses whispering updates, machines beeping their small symphony of suffering. Malik moved through it like a shadow, white coat flowing behind him, exhaustion in every step. He'd slept 3 hours. He'd spent most of the night thinking about why he hadn't let the anger win, why he'd still saved Walter Briggs, why the oath still mattered even when it hurt. By a.m., the hospital was stirring. Amara was already checking charts, coffee in hand, her expression unreadable. She caught Malik's eye across the station. "Didn't go home?" she asked. He shook his head. "Didn't feel like sleeping. You know, one day, this place will eat you alive if you keep feeding it like that." He smiled faintly. Too late. Before she could reply, the intercom crackled. "Code Blue, ICU Bay 3. Code Blue." Amara's coffee hit the counter as they ran. Walter Briggs' room. His monitors were screaming, lines jagged, alarms flashing red. A nurse was already performing compressions. "Lost pulse, doctor," she said, breathless. Malik was at the bedside instantly. "Continue compressions." "Amara, 1 milligram epi." "Let's go." Amara moved fast, steady, voice clear. "Epi in. Pushing now. Charging to 200, Malik ordered. "Clear." The jolt hit Walter's body like lightning. The monitor flatlined, then sputtered, one blip, two, then a rhythm. "Got him," Malik said, voice steady but his pulse racing. The room fell into controlled quiet again, the kind that follows chaos. Amara exhaled, wiping sweat from her brow. Malik stared at Walter's face, pale, aging, mouth slack behind the oxygen mask. For a second, he wasn't a patient. He was the man. The one from years ago. The one who'd called him boy in a hospital corridor. And now Malik's hands, the same ones Briggs had once dismissed, were the reason he still drew breath. Dr. Sophia Lynn arrived minutes later. "Good work, team," she said, assessing the scene. Her eyes landed on Malik. "You okay?" He nodded, but his hands were still trembling slightly. "All right," she said. "Stabilize him and meet me in my office in 10. Amara glanced at Malik, silently asking if he wanted her to stay. He shook his head. "Go ahead. I'll be fine." But he wasn't. Sophia's office was quiet to quiet. The blinds were half closed, the faint hum of the hospital seeping through the walls like distant waves. Malik stood by the window, arms crossed. "Sit," Sophia said. He did. "I got a report," she began, "from the nursing staff. There was an incident yesterday." Words exchanged. Malik sighed. "If you're asking if he insulted me, yes, multiple times, and you responded?" I stayed professional. She leaned back, studying him. "You sure about that?" He hesitated. "Mostly." Sophia's tone softened, but her eyes stayed sharp. "Malik, you know how this looks. You have a personal history with this man. And now he's your patient." "I didn't choose that," he said. "I know, but it's my job to make sure this doesn't turn into an ethics complaint. You're one of the best trauma surgeons we have, but you're also human." Malik looked down at his hands. "He almost died this morning. Because of you." "He didn't," Sophia said. "But that doesn't change what's coming. HR's already asking for documentation. They want to know if you can remain primary on his case." He looked up sharply. "You're not reassigning me." "I might have to," she replied quietly. "For your sake as much as his." Malik stood, frustration rippling beneath his calm exterior. "I've treated murderers, addicts, bigots, every kind of man who looked me in the eye and saw something less. I didn't care then, and I don't care now. I'm not walking away from this one." Sophia didn't move. "Why?" He paused, breathing deep. "Because it's not about him anymore. It's about me." Meanwhile, Amara was checking Walter's post-resuscitation vitals. His color had improved. His eyes fluttered open, groggy. "What happened?" he murmured. "You coded," Amara said. "Your heart stopped." Walter frowned weakly. "So I'm still here, huh?" "Yeah," she said softly. "Thanks to Dr. Carter." He closed his eyes. "Of course." Amara hesitated. "You don't have to like him, but maybe you should know he didn't hesitate." Not for a second. Walter didn't respond. He just turned his face away, but his breathing hitched not from pain, but from something heavier. Later, as the rain began again outside, Amara and Malik found themselves in the break room, both too drained to speak. The fluorescent light buzzed overhead like a tired insect. "You almost lost him," Amara said quietly. "I know. You didn't have to bring him back." Malik looked at her. "Yeah, I did." She tilted her head. "Because of the oath?" He nodded slowly. "Because of the oath." Amara's voice dropped to a whisper. "And what does it feel like, saving a man who'd rather see you dead than healed?" Malik didn't answer. He stared at the steam rising from his untouched coffee. Finally, he said, "It feels like holding your own anger under a microscope and realizing it's eating you faster than it ever ate him." Amara sat in silence for a moment. "That's heavy." "It's honest." Hours later, Malik returned to Walter's room. The lights were low. The man was awake again, weak but alert. "You had a rough morning," Malik said. Walter's voice was raspy. "You didn't have to do it." Malik frowned. "Do what?" "Bring me back." He stayed quiet. Then, softly, "I did." Walter stared at him, eyes sharp but trembling. "Why? You could have let me go. After what I did to you." Malik's breath caught. "You remember?" Walter nodded slowly. "Took a while. You were the kid, the intern at Steedy. James, you looked at me like I was filth, and I gave it right back." "I wrote that report." Malik's chest tightened. "You cost me my job." "I know." Silence filled the room, thick, unbearable. Walter looked away, shame creeping across his features like shadow. "You should have let me die." Malik's voice was steady, but his eyes burned. "You don't get to decide that." "Not anymore." The door creaked open. Amara stepped in, holding a chart, but froze when she saw the look between them, raw, unfiltered, dangerous. "Everything all right here?" she asked carefully. Walter's voice was quiet. "He saved me." "After what I did?" Amara glanced at Malik, then back to Walter. "That's what doctors do." "No," Walter said, shaking his head. "That's what men do when they're better than the rest of us." Malik's throat tightened. He didn't know what to say. Amara spoke first. "Maybe this is your second chance, Mr. Briggs." "Don't waste it." Walter nodded faintly, then closed his eyes. That night, Malik sat alone in the empty chapel on the hospital's lower floor. The air smelled of candle wax and disinfectant. He stared at the altar, simple wood, no cross, no words, just silence. He thought about the oath. First, do no harm. It had sounded noble once. Now it just felt heavy. He whispered into the stillness, what does it mean to do no harm, when just remembering hurts? No answer came, only the hum of the air conditioning, the soft flicker of candlelight. He closed his eyes. For the first time in years, he prayed not for forgiveness, not for Walter, but for peace. Peace from the anger that refused to die, the same way Walter Briggs refused to die. At a.m., Amara found him still there. She didn't speak. She just sat beside him, the two of them staring into the same empty air. Finally, she said, "You're not alone in this, I know," he whispered. "That's what scares me." She smiled faintly. "Then maybe that's what saves you too." He looked at her, eyes tired but softer than they'd been in days. Maybe the night was long, but for the first time since Walter's arrival, Malik felt something shift inside him. Not forgiveness. Not yet. But the smallest seed of it, fragile, buried deep beneath exhaustion and pride. And somewhere, 2 floors above, Walter Briggs slept, heart weak, mind restless, but alive. Alive because of the man he'd once broken. Alive because mercy had chosen to wear Malik's hands that day. Morning came without color. The sky above steady. Victoria was a dull canvas, neither dawn nor daylight, just a limbo of gray. Inside, the hospital hummed with its usual orchestra, ventilators sighing, carts rolling, voices low and urgent. But beneath that rhythm, there was tension, the kind that people feel before something breaks. Dr. Malik Carter was reviewing Walter Briggs' chart when the first alarm went off. Room 312, patient desating, a nurse called. Malik looked up, his heartbeat spiking. "Briggs?" "Yes, doctor." He was moving before the nurse finished. When Malik reached the room, Amara Johnson was already there, pulling back the curtain, her movements precise and controlled. "SPO at 78, she said quickly. "He's gasping, doctor. Get respiratory here now," Malik ordered, slipping on gloves. "Bag him if you have to." Walter's face was pale gray, lips blue, his breath shallow and erratic. "Mr. Briggs, stay with me," Malik said, pressing a hand to his shoulder. Walter's eyes fluttered open wide, panicked. "Can't breathe. His lungs are filling," Amara said, scanning the monitor. "Possible PE or internal bleed, page CT. Prep for stat imaging," Malik snapped. But as the team worked, Walter's body convulsed. The monitor screamed, "Code blue, room 312, within seconds." The corridor was alive with motion, feet pounding, doors swinging, voices layering into chaos. Malik began compressions, counting under his breath. 1, 2, 3. Sweat streamed down his forehead, his voice hoarse but steady. Amara stood at his side, pushing meds, her expression unreadable. "Epi 1 milligram in. Charging to 00, Malik said. "Clear." The jolt threw Walter's chest upward. "Nothing." Again, clear. The monitor flatlined and then, slowly, faint waves crawled across the screen. "We got a rhythm," Amara said, exhaling. "Weak, but it's there." Malik leaned against the bed rail, chest heaving. His hands trembled not from exhaustion, but from something deeper. Rage, fear, guilt, a mixture too complicated to name. Dr. Sophia Lynn entered just as the team began stabilizing Walter. "What happened?" Malik didn't turn. "Acute embolism, possibly post-op clot. He's unstable. Transfer him to ICU immediately," Lynn said. "And Malik, after that, I need to see you." Her tone was professional. Her eyes were not. 2 hours later, Malik sat across from her again. This time, there was no pretense of small talk. "HR called me," Lynn began. "They're reviewing the situation," Malik frowned. "What situation?" "Your continued involvement in Briggs' case. They've received an anonymous concern. A nurse mentioned the argument you had with him and his prior connection to you, so now they're calling it a conflict of interest." Lynn folded her hands. "They're calling it potential bias," he laughed bitterly. "Bias? That's rich." "Malik, no, listen." he said, leaning forward. I've done everything right. Every procedure, every chart, every damn hour I've stayed awake to keep him alive. And now they want to question my objectivity because he was the racist. Lynn's voice stayed level. They're questioning because you have history. That's how it works. Malik's jaw tightened. You ever get tired of systems that protect men like him and scrutinize men like me? Lynn sighed. Every day. But anger won't fix this. You will. You stay clean, you stay professional, and you let your work speak. He nodded slowly. I've been letting my work speak for years. No one ever listens. Meanwhile, upstairs, Amara was monitoring Walter's vitals. He was awake now, weak and pale. Welcome back, she said quietly. Walter's voice was barely audible. Did I die again? You tried. He gave a faint, bitter laugh. Guess he didn't let me go this time either. Amara adjusted his oxygen, ignoring the sting behind his words. You were lucky. He turned his head slowly. He still hates me, doesn't he? Amara met his gaze. If he did, you wouldn't be breathing. That silence between them felt heavy, not hostile anymore, but hollow. Later that afternoon, Malik stood in the observation bay overlooking Walter's room. He watched the old man sleep, his chest rising in fragile rhythm. Amara joined him. They're talking about pulling you off his case, she said. I know. You gonna fight it? He didn't answer right away. Finally, he said, part of me wants to walk away. Let someone else carry it, and the other part wants to prove I'm better than the worst thing that ever happened to me. Amara crossed her arms. That's not medicine, Malik. That's vengeance wearing a lab coat. He looked at her, startled. You think that's what this is? She shrugged gently. I think you're human, and humans bleed from both sides even when they pretend they don't. Her words lingered long after she left. That night, the hospital was quiet again, the kind of quiet that only comes after chaos. Malik was writing notes in the charting room when he heard footsteps. Walter's daughter, Claire, stood in the doorway. Dr. Carter, she said softly. Can we talk? He gestured for her to sit. I heard about what happened this morning, she said. They said you saved him. Again, he nodded. That's the job. She looked down. It's more than that. I overheard something earlier. My father was awake for a bit. He mentioned what he did to you. Malik froze. I didn't know, she said quickly. Not until now. He told me everything. And I'm sorry. He shook his head. You don't owe me an apology. Yes, I do. Because he never will. Malik's expression softened, but his tone stayed even. What he did is his burden. You're not responsible for it. Tears filled her eyes. Maybe not, but I'm the only one left to fix the mess he made. Malik leaned back, exhausted. Some things can't be fixed. They can only be lived through. She nodded slowly. Then maybe all of this is his punishment, or his redemption, Malik murmured. Do you believe that? She asked. He looked away. I want to. Hours later, just before dawn, Walter woke again. The room was dim, a single monitor casting soft light on his face. Malik was there, adjusting the drip. Walter's voice rasped. Why do you keep coming back? Malik paused, then said simply, because you need me to. Walter chuckled weakly. You're a better man than me. No, Malik replied. Just one who's still trying. Walter swallowed hard. His hand trembled as he reached slightly toward Malik's sleeve, not quite touching, but close. I was wrong about you, he whispered. Malik looked down at him, emotion flickering across his usually calm face. You were wrong about a lot of people. Yeah, Walter said softly. And now it's too late to make it right. Malik shook his head. It's never too late to do one right thing. Minutes later, Walter's monitor beeped an irregular rhythm. Amara rushed in. BP dropping. Malik checked the screen. He's bleeding internally. Get blood ready. Call Dr. Lin. They worked in silence, suction, clamps, pressure bags, hands moving faster than thought. But as the numbers kept falling, Amara looked up, voice shaking. We're losing him. Malik pressed harder on the wound, his voice rising. Stay with me, Briggs. You hear me? Walter's eyes flickered open. I do. Then they closed again. The monitor flattened to one long tone. They fought for 10 minutes. 10 long, merciless minutes. And then Malik stopped. He stood there, sweat running down his face, gloves red, chest heaving. Amara's voice was soft, trembling. Time of death? Malik swallowed. 5:43 am. Silence filled the room. Amara stepped back, eyes glassy. Malik just stared at the still body, at the life that had haunted him, challenged him, changed him. Finally, he whispered. He asked why I kept coming back. Amara looked at him. What did you tell him? That he needed me, she exhaled. Maybe you were wrong. Maybe you needed him. Malik turned toward her, eyes wet. Yeah, he said quietly. Maybe I did. The rain started again outside. Slow, relentless, cleansing. In the end, Walter Briggs died in the care of the man he once destroyed, not forgiven, not redeemed, but human. And Malik Carter stood in the aftermath, realizing that sometimes mercy doesn't save, it just frees. The rain had stopped by the time the body was moved, but the sound of it still lingered in the halls, that ghostly echo of something cleansing what could never truly be clean. Dr. Malik Carter stood by the window outside the ICU, still in his surgical gown, gloves gone, eyes hollow. Below him, dawn was breaking in slow motion, painting the hospital courtyard in bruised shades of gray and gold. For a long time, he didn't move. He just watched the world try to start over. Behind him, the faint creak of the door broke the silence. Nurse Amara Johnson entered quietly, carrying 2 cups of coffee, one for him, one she knew he wouldn't drink. You should change, she said softly. You've been standing there an hour. Malik didn't answer. His voice was somewhere else. I thought I'd feel something different. Amara tilted her head. Like what? Closure, relief, anger, something, he exhaled. But it's just quiet. She placed the coffee beside him. That's what it feels like when the storm's done wrecking you. He turned toward her, eyes red but dry. You think it's over? She met his gaze. No, I think it's finally starting. Downstairs, Dr. Sophia Lynn was signing the preliminary death report. When Malik entered, she looked up briefly, expression neutral, voice even. Cause of death? She asked. Massive internal hemorrhage, Malik said. Likely secondary to clot displacement. We tried everything, Sophia nodded. I know you did. There was silence. The kind that holds more meaning than words. Then she said, HR's off your back now. There'll be no further investigation. Malik let out a slow, bitter laugh. Took a death to clear my name. Poetic. Sophia leaned back in her chair. You want honesty? He nodded. People saw what you did, she said. They'll forget his name long before they forget yours. You didn't just save a man who hated you. You honored the oath that most doctors only repeat. Malik's jaw tightened. That's supposed to make me feel better? No, Sophia said quietly. It's supposed to remind you who you are. He said nothing, just stared at the wall, the hum of the overhead light buzzing like static in the distance. Finally, he murmured, It doesn't feel like I saved anything. Sophia closed the folder. That's because saving someone doesn't always heal you. Later, Malik found himself in the hospital chapel again. Same room, same stillness. The candlelight flickered against the sterile glass like defiance, a soft rebellion against the fluorescent world outside. He sat in the same pew as before, head in his hands. He remembered every word Walter Briggs had said. You shouldn't have brought me back. You're a better man than me. It's too late to make it right. He replayed those words until they started to sound like his own. The door opened behind him. Amara entered again, her footsteps quiet against the tile. Thought I'd find you here, she said. Malik looked up, weary. You always do. She sat beside him. How's it feel? Like I lost twice, he said. Amara leaned forward, elbows on knees. You didn't lose. You did the right thing. He laughed, hollow. The right thing for who? For him? For me? Because it sure doesn't feel like either. Amara turned to face him. You're asking the wrong question, he frowned. Which is? It's not why you did it. It's who you became because you did. Her voice lingered in the still air. That afternoon, Malik walked into Walter's now empty room. The bed was stripped, the monitors gone. The smell of antiseptic and regret clung to the air. He stood in the doorway, hands in his pockets. For the first time, he noticed something small left on the tray table, a folded piece of paper, the kind nurses use for shift notes. But it wasn't handwriting he recognized. He unfolded it slowly. The message was brief, shaky, and barely legible. For what it's worth, I was wrong. I see you now. Thank you. Abu Malik stared at it for a long time. His throat tightened. Amara appeared behind him. What is it? He handed her the paper silently. She read it, then looked up. Her eyes softened. Guess he found a way to say it after all, Malik whispered. He waited until the end. Amara nodded. Maybe that's when people finally listen. Outside, the rain started again. Malik walked through the courtyard, coat collar turned up, hands deep in his pockets. Every drop felt heavier than the last, not cold, just grounding. He passed the fountain, where water pooled dark and still. He stopped. For a second, he saw his reflection in it, tired, older, haunted. The mirror never lies, he thought. But it doesn't always tell the whole truth either. In the evening, Malik sat in the staff lounge, staring at the note again. The paper was worn from his fingers, edges damp from the rain. Amara entered with dinner trays, setting one beside him. You're still here, she said. So are you, she smiled faintly. I'm used to the ghosts. He looked up at her, eyes softer now. You ever wonder why we keep doing it? Saving people who don't deserve saving? She sat down across from him. Because sometimes we need to believe they might, he nodded slowly. You really think he changed? Amara shrugged. Change doesn't always mean transformation. Sometimes it's just recognition. Malik stared at the note again. Maybe that's enough, maybe, she said. And maybe it's enough for you too. He looked at her, realizing for the first time that she wasn't talking about Walter anymore. Later that night, Malik walked the corridor one last time. Walter's daughter, Claire, was by the nurse's station, signing paperwork. When she saw him, she stood. Dr. Carter, she said softly. I wanted to thank you for everything, he nodded. I'm sorry for your loss, she smiled faintly. I'm not sure it's a loss. Maybe it's just the end of something that should have ended years ago. She hesitated, then added, he told me before the last surgery that he wished he'd had the courage to face you sooner. Malik blinked, taken aback. He said that? She nodded. He said you were the only man who ever made him feel small, and that's how he knew he was wrong. Malik didn't know what to say. Claire reached into her bag and handed him a folded photo, an old picture of a younger Walter, smiling beside a patrol car. I think he wanted you to have this, she said. Malik took it, confused. Why? He said. So he remembers the man I was before I forgot how to be one. She smiled sadly, then walked away. Malik stood there, holding the photo and the note, to relics of a man who had taken and given something he could never replace. The photo trembled slightly in his hands, wet from the rain still clinging to his coat. He whispered, You took my piece once. Maybe this is how you gave it back. When Malik finally stepped outside, dawn was returning again, quiet, unassuming. The sky, once bruised, was soft now. He stood on the hospital steps, letting the light hit his face. For the first time in years, he didn't feel like he was fighting the world. He was just in it. Flawed, human, healing. Behind him, Amara appeared, coat in hand. Morning looks different today, she said. He smiled faintly. So do I. She handed him the coat. You done being angry? Not yet, he said. But maybe I'm done letting it decide who I am. Amara nodded, her voice almost a whisper. That's how it starts. They stood there for a moment, silent, to figures framed by the soft gold of a forgiving sunrise. And as the city woke around them, Malik finally understood. Forgiveness isn't something you give away. It's something you survive long enough to earn. Hospitals forget people fast. One day you're the center of chaos, the next, you're just another chart archived, another room stripped clean. But not everyone gets to forget. For Dr. Malik Carter, the echo stayed. They lingered in the hallways, in the click of monitors, in the scent of antiseptic that clung to his hands long after washing. He thought about Walter Briggs every day, not with anger anymore, but with that strange, hollow ache that comes after a long war ends and you're not sure what peace even feels like. It had been 3 weeks since Walter's death. 3 weeks of pretending things had gone back to normal. Amara found him one morning in the resident lounge, watching rain bead against the window. "You still look like you're carrying ghosts," she said. He smirked faintly. "They make good company." She sat beside him, her scrubs a shade darker than usual, hair tied back. "You know, there's therapy for that kind of statement," he chuckled softly. "I have you." "That's cheaper." Amara's eyes softened. "Cheaper, yes. Easier? Never." They sat in silence for a moment, listening to the rain. Then, through the intercom, came the words that could turn any quiet morning into a storm. "Incoming trauma mail, late 40s, GSU to the chest. ETA 5 minutes." Malik's expression changed instantly. "Let's go." Amara followed. "You sure you're ready for this?" He didn't answer. He was already halfway down the corridor. The trauma bay erupted in motion as the paramedics burst through the doors. 47-year-old male, gunshot wound to the left thoracic cavity, unconscious at scene, the EMT called. BP 70/40, pulse thready. Malik's gloves snapped on. On my count 1, 2, lift. They moved the patient to the gurney. Blood pooled beneath him, the metallic scent sharp in the air. Amara connected monitors. "Pressure's crashing. Chest tube now," Malik ordered. "Let's go." The moment the tube went in, air hissed out a wet gasp, life clawing its way back. "Got breath sounds," Amara confirmed. "Type and cross for units," Malik said. "He's going to the OR," but as he leaned in to assess the wound, the light caught the patient's face, pale, bruised, but familiar. Amara froze first. "Malik," he looked closer, his breath catching. It wasn't Walter Briggs, but it could have been. Same eyes, same jawline, same age, same kind of man. A memory collided with the present flash of another gurney, another pulse fading, another man who'd once called him boy. For a heartbeat, Malik couldn't move. "Doctor?" the resident asked. "What are your orders?" Malik blinked hard, forcing his voice steady. "Prep for surgery. We're not losing this one." In the OR, the hum of machines was the same song he'd lived in for years, steady, mechanical, heartless. Blood loss was massive. The bullet had shattered to ribs, nicked an artery, grazed the lung. Amara worked opposite him, her movements sharp, controlled. "Clamp," Malik said. "Now." Clamped, pressure up, rising. He exhaled through his mask. "Good. Hold it there." The team moved like choreography, every gesture memorized, every second borrowed. And yet, beneath the precision, Malik's mind wandered. He saw Walter's face in the flicker of the monitor, heard his voice in the rhythm of the ventilator. "Why did you bring me back?" He swallowed hard. "Focus." 2 hours later, the bullet was out. The bleeding stopped. The man lived. Malik stepped back, stripping off his gloves. His hands were trembling, not from fatigue, from realization. He'd done it again. Saved another stranger who looked too much like the past he couldn't outrun. Amara noticed his silence. "You okay?" He nodded. "Yeah, just déjà vu." She frowned. "You saw him again, didn't you?" He didn't answer, but she didn't need him to. Later that evening, Malik sat outside on the hospital steps, scrub top damp from rain, the city spread before him like a confession. Amara joined him, holding 2 paper cups. "He's stable," she said, sitting beside him. "Surgery was clean." Malik nodded. "Good. You're not talking much." He let out a quiet laugh. "You ever get the feeling the universe is recycling your lessons until you finally learn them?" Amara smirked. "Only every day." He turned toward her. "I keep thinking about that question, why we save the ones who don't deserve it, and," he looked out at the rain, "I think it's because if we stop doing it, we stop being who we are." She smiled faintly. "Now that sounds like a doctor again." The next morning, Malik was checking on his post-op patients when Claire Briggs appeared in the hallway. He froze. "Claire," he said, surprised. "What are you doing here?" "I volunteer here now," she said, smiling gently. "Patient liaison program." He blinked. "You did that because of your father?" "Because of you," she said. "He told me once that you never stopped doing what was right, even when he couldn't understand why." I wanted to know what that kind of strength felt like. Malik's throat tightened. "You didn't have to, I did," she interrupted softly. "Someone has to carry something good out of all that." They stood there for a moment, the hum of monitors between them. Finally, she said, "Thank you for saving him. And for letting him die right." He nodded slowly. "He taught me more in dying than he ever did living." That night, Malik found himself in the staff break room again, staring at the old photo Claire had given him. He'd kept it in his locker folded, but never thrown away. Amara entered quietly. "Still visiting the past?" He smiled. "It visits me first." She sat across from him. "You ever think you'll stop carrying it?" "Maybe we're not supposed to stop," he said. "Maybe we just learn how to hold it without bleeding every time." She studied him for a long moment. "You've changed, or maybe," he said softly, "I finally stopped fighting the change." The next emergency came just before midnight. Car accident, multiple injuries. Malik and Amara ran side by side again, just like always. Different names, same chaos, same purpose. Inside the trauma bay, Malik took command with calm precision, not detached, but centered. The kind of focus that comes only after losing enough battles to know which ones matter. He didn't think about Walter Briggs. He didn't think about pain or race or pride. He just thought about breath, about heartbeat, about life, fragile, fleeting, worth saving no matter who it belonged to. Hours later, the hallways were quiet again. Malik washed his hands slowly, the water running pink before turning clear. He stared at his reflection in the metal faucet, tired, lined, but alive. Behind him, Amara's voice broke the silence. "You know what I think?" He looked up. "What?" She leaned against the doorway. "You didn't just save that patient tonight. You saved yourself." He smiled faintly. "Guess I'm still worth saving then." "You always were," she said. And for the first time, he believed her. The morning light crept through the hospital windows, quiet, silver, forgiving. The kind that doesn't announce a new beginning but suggests one, gently. Malik stood at the window again, watching the city wake up. He took a deep breath, the air heavy with rain and renewal. Behind him, Amara said, "You ready for another day?" He nodded. "Yeah, maybe this time, I'll do more than just save people. Maybe I'll start living again." She smiled. "That's the spirit, doctor." They walked together down the corridor to figures carrying the weight of mercy and memory, side by side. And somewhere in the stillness of the hospital, Malik Carter finally understood what redemption really was. Not forgiveness, not forgetting, just the courage to keep showing up, heart open, hand steady even when the world didn't deserve it. Hospitals never really sleep, they just hold their breath between heartbeats. And in those brief silences, people either find themselves or lose what little they had left. For Dr. Malik Carter, that silence had become familiar. Not peaceful, but purposeful. Like the calm after a storm that didn't destroy him, only revealed what had survived. It had been 6 months since Walter Briggs' death. 6 months since Malik faced the man who broke him, and found, somewhere inside that wreckage, a version of himself worth saving. Now, as he walked through the corridors of St. Victoria, the world felt different, not kinder, but clearer. "Dr. Carter," a voice called. He turned. It was Claire Briggs, clipboard in hand, wearing a volunteer badge that still looked new. "Morning," Malik said. She smiled faintly. "You keep showing up early." "Most doctors don't. Old habits," he replied. "Hard to break." She hesitated. "They're holding a memorial today for patients who passed this year. They're including my father's name." Malik's expression softened. "You going?" She nodded. "I think so. He wasn't a good man, but he was my father. I guess people can be both." Malik nodded slowly. "Most are." Claire looked at him, her voice almost a whisper. Do you ever think he found peace? Malik paused. If he didn't, maybe what we did gave him a piece of it. She smiled sadly. That's more mercy than he deserved. Maybe, Malik said. But mercy isn't about who deserves it. Later that morning, Malik stood in the hospital courtyard, the same place where rain once washed away blood and guilt. Now the air was still, sunlight filtering through the trees. Amara joined him, her white coat open, eyes calm but watchful. You're quiet again, she said. He smiled. I'm thinking, that's always dangerous. He chuckled softly. About how this place never changes. Same walls, same noise, same chaos. And somehow it still keeps teaching. Amara folded her arms. That's the thing about hospitals. They break you, rebuild you, then send you back in for another round. He looked at her. You think we ever get out of the cycle? She shrugged. Maybe the point isn't getting out. Maybe it's learning to breathe while you're in it. That afternoon, the memorial was held in the hospital atrium. Dozens of candles lined the floor, one for every name on the list projected against the glass wall. Families stood in quiet clusters, holding hands. The light flickered against faces that had known both loss and gratitude. Malik didn't plan to speak, but when Claire looked at him, eyes glistening, he knew he couldn't stay silent. He stepped forward, his voice low, steady, carrying across the hum of machines and whispered prayers. We work in a place that sees everything, the best and worst of people. We hold hands of strangers, hear final words, witness miracles that science can't explain. But the hardest part isn't what we lose. It's learning to see the people we thought we understood, and realizing we never really did. He looked down at Walter Brigg's candle, the flame trembling slightly. There was a man I once thought I'd never forgive, and maybe I never will, not completely. But I learned something in the trying. Forgiveness isn't a gift for the other person. It's a way of remembering yourself before the anger took too much. His voice faltered for a moment, not from fear, but from honesty. We all live under the same skin, same blood, same fragility, same need to be seen. And maybe that's the lesson, that what divides us is smaller than what keeps us alive. The silence that followed wasn't empty, it was full of grief and grace and something almost like understanding. After the service, Malik found Amara sitting on the hospital steps, the sunset washing the courtyard in amber light. You sounded like a preacher in there, she said. He smiled faintly. Didn't mean to. Well, it worked. Half the staff's in tears. He sat beside her. You cry? She grinned. Never. Just. Inhaled dramatically. They laughed quietly, the kind of laughter that only people who've seen too much can share. As the light dimmed, Amara said, You ever think about leaving? Doing something else? Malik stared at the horizon. All the time, and then someone comes in broken, bleeding, begging for help, and I remember why I can't. Amara nodded. You don't do it because they deserve it. No, he said softly. I do it because I need to believe they can. Night settled again over Steedy. Victoria, that quiet hum of machines and heartbeats returning to their rhythm. Malik made one last round through the ICU, stopping briefly at each bed. He checked drips, adjusted monitors, whispered soft reassurances no one heard. In one room, a child slept, tiny chest rising beneath a tangle of wires. Malik stood there a long time, hand resting lightly on the bed rail. Hang in there, kid, he murmured. World's rough, but it's still got room for good people. He wasn't sure if he was talking to the boy or to himself. Hours later, Malik walked through the empty hallway toward the exit. The lights were dimmed, reflecting softly against the polished floor. Each step echoed not lonely, but steady. Amara's voice came from behind him. You're actually leaving before sunrise? He turned, smiling. First time for everything. She walked up beside him. You know, for a man who used to live in shadows, you look pretty good in the light. He looked at her for a moment, quietly. Maybe it's because I stopped running from it. They stepped outside together. The night air was cool, carrying the faint scent of rain and jasmine. Amara looked at him. You ever think we're just patching holes in a sinking ship? Malik shrugged. Maybe, but if we stop patching, More people drown, she smiled. You really are addicted to hope, he laughed softly. Guilty, they stood there in the stillness, city lights shimmering across wet pavement. When they finally walked away from the hospital, Malik looked back once more. The building loomed in silence, the same walls, same flickering windows, same ghosts. But this time, he didn't see the pain. He saw people. He saw humanity. He saw himself. Voiceover narrator tone suggestion. In the end, forgiveness isn't about absolution. It's about endurance. About choosing to keep your heart open even when the world gives you every reason to close it. Because we all live under the same skin. And what we do with that truth is what defines who we are. The screen fades to black as the soft hum of hospital monitors gives way to the sound of a heartbeat, steady, human, infinite. Fade out.